My name is Heun. I'm a consultant psychiatrist and editor of Global Psychiatry Archives, and I would like to talk about schizoaffective disorder, which has some relationships with schizophrenia and affective disorder. Affective disorders are those which are related to manic and depressive symptoms, and in schizoaffective disorder, the schizophrenic type symptoms and the affective disorder type symptoms are more or less equally in patients suffering this disorder. The lifetime prevalence is 0.5 to 0.8%. The gender and age differences or prevalence in these different age groups are not totally clear. Some people would say that bipolar disorder and schizophrenia lie on a spectrum. They call it unitary psychosis, and schizoaffective disorder lies more or less in the middle. There are different classifications: the International Classification of Diseases, ICD-11, and the Diagnostic and Statistical Manual for Mental Health Problems, which is in the 5th version, which is called DSM-5. And in both cases, patients with episodes of schizophrenia and affective disorder and relationship to people with substance abuse are not included. So patients with substance abuse or other medical disorder are excluded simply because substance abuse can mimic depression or cause depression and can mimic psychosis or schizophrenia. So in the ICD-10, schizoaffective disorder should have 2 weeks, or in ICD-11, 1 month of symptoms of both of these disorders and should be equally prominent. And in the ICD-10, it should be more than 2 weeks of delusions and hallucinations without any prominent mood symptoms during the lifetime of the illness. Symptoms meeting criteria for mood episodes are present for the majority of the total duration of the active and residual periods. So in this case, the criteria mean that people have episodes which resemble schizophrenia, but they have lots of times when they have depression. And this shouldn't be related to any medication and any drugs. The treatment is related to the symptoms. So if you have more psychotic symptoms, antipsychotics are indicated. If the patients have more depressive symptoms, then antidepressants are the relevant treatment. Usually the cause is better than schizophrenia. It's not as chronic, and people have not this development of severe negative symptoms, which can severely deteriorate the life of the patients. So these negative symptoms which are happening in schizophrenia are lack of drive, lack of motivation, lack of interest, and lack of social functioning or reduction of that. So this is schizoaffective disorder, which is related to schizophrenia and affective disorders. And yes, it's a mixture, and this can be treated. The prognosis is not that bad as for schizophrenia, and treatment is more or less symptomatologic, is based on the symptomatology of the individual patient's symptoms. I hope you like these clarifications, and if you like our series of mental health disorders explained, please subscribe to our channel, Global Psychiatry Archives, and have a nice evening. Goodbye.